All right, so now we're going to focus in on blood and blood forming organs and those diseases and disorders that fall into this category. Okay, so again, we're going to do a brief review over the anatomy and physiology, and then we're going to get into some specific diseases. So guys, when we look at the anatomy and physiology with blood, this is what we would consider the hemorrhagic system. All right, it's the major function of blood is to transport, and it's going to transport nutrients to the cells. This includes oxygen, glucose, maybe even hormones, just different things the cells need. But it's also going to transport away waste products. This includes the waste products from just cellular respiration, CO2, urea, lots of different waste products can also be removed here. Now, when we look at an average adult has anywhere between 5 to 6 liters of circulating blood. Now, of course, the larger the adult is, the more blood they probably have present. Now, when we look at blood is broken down into certain components. You'll see here that if we took the blood and we put it through a centrifuge, which is a machine that just spins it super fast, we're going to get the blood into two main sections. You're going to have the plasma, which is 55% of the total blood volume, and this is the liquid portion of the blood. Okay, this is mostly made out of water, but it also has solutes dissolved in it like sodium, oxygen, carbon dioxide, different things like that. Okay, the formed elements is 45%, and the formed elements are the cells that are part of the blood. This includes your red blood cells known as your erythrocytes. We also have the platelets known as thrombocytes. We have the neutrophils, basophils, eosinophils, lymphocytes, and monocytes. These are all white blood cells, which are known as leukocytes. Now, when we look at blood, guys, blood has certain characteristics. It is red in color due to the oxygen. We also see that the volume we just said was anywhere between 5 to 6 liters. The viscosity, it's going to be thicker than water, okay, but we don't want blood to be too thick like molasses or honey. We need it to still be able to flow, but it is thicker than water. And the pH is slightly alkaline. It has a pH of anywhere between 7.35 and 7.45. Remember, 7 is neutral. It's slightly alkaline or basic, not a lot, but a little. Now, red blood cells. When we talk about red blood cells specifically, we talked in a past lecture a little bit about blood typing and that sort of thing. We do see that this is super important. Red blood cells are going to be based on whether you're type A, B, O, or AB. This is going to determine what kind of blood you can get or who you can give blood to. This is a big deal when we talk about emergency situations and things like that with the blood. So if you are a type O, you are the universal giver. You can give blood to anybody. If you have type A blood, you can give it to A and AB individuals. B can give it to B and AB can only give it to AB. So AB is the universal getter because it can get blood from pretty much everybody. Okay, but O can only get blood from O. Okay, it cannot get it from anyone else. All right, so let's talk a little bit about these red blood cells, these erythrocytes. Besides the fact that they help give you your blood type, we do see that there is a normal count that's normally present. Now, this can be anywhere between 4.2 to 6.3 million per microliter of blood. So you're going to have a lot of red blood cells found in your blood. The lifespan of a red blood cell is about 120 days, so they live about 4 months. These red blood cells form in your bone marrow. They do not reproduce on their own, so they have to come from stem cells that are found in your bone marrow. Hemoglobin is the important protein that is found inside of these red blood cells. It is the protein that allows them to carry oxygen. All right, allows the red blood cells to carry oxygen, which is their main job. We see that there's normal hemoglobin levels, but they're going to be different between men and women, and this is based on how much blood is present. Men tend to have a little more volume of blood than women do. So there should be anywhere between 13.5 to 18 hemoglobin in grams per 100 milliliters of blood. In women, we should see anywhere between 12 to 16. All right, so it's a little bit less when we look at women. Now, one thing to note about hemoglobin, hemoglobin does require iron in order to form properly. When we talk about the protein, it's going to need 4 irons, 4 hemes, in order to fuse the protein together. And guys, one red blood cell can actually have like 280 million hemoglobin proteins inside the one red blood cell. All right, so hemoglobin is super important. All right, let's look really quick at the leukocytes and the platelets. Leukocytes protect individuals from infection. That's their main role. You can see them here. They're the white blood cells. When we look a lot of times at stained blood, they do appear purple because that's how they're stained. The normal count inside of individuals is anywhere between 4.5 or 4,500 to 11,000 per what we would call millimeters cubed. This is kind of the normal range. If we're below this range, we have an issue because this would be more like immunodeficiency. If we're above that range, then we have something that would be more like an infection or inflammation that's present. On the other hand, we also have the platelets. Platelets are known as thrombocytes. You can see them here in kind of the purpley color. These guys are super important in blood clotting. So they're going to help you with blood clotting, and our normal count is normally between 150,000 and 350,000 in our units of blood. Now, normal values may vary some from different laboratories or sources, and so a lot of times based on where you work, when you get blood work from the patient, they'll have the kind of normal values off to the side for you to be able to do comparisons. Now, let's review real quick the blood forming organs. Because red blood cells, white blood cells, and platelets are going to need to be formed from stem cells, there's going to have to be some organs that help form these. And these are the lymph nodes, the bone marrow, the spleen, and the liver. They are going to help in some way with the life cycle of blood. Now, the lymph system protects against pathogens, so this is where a lot of your white blood cells, especially your lymphocytes, will be found. Bone marrow is the major cell producer. Okay, so when we look at this, bone marrow is going to be where the stem cells are located to create blood. The spleen produces lymphocytes, plasma cells, which are the ones who help with making antibodies. And these guys are also going to filter out microorganisms from the blood. They're going to help trap things. Another thing the spleen does that's not listed here is that it also helps recycle worn out red blood cells. After those red blood cells have served their 4 months, the spleen helps recycle those. We also see the liver. The liver is going to produce what we call prothrombin and fibrogen. Both of these are required specifically for the blood clotting cascade. So in order for our blood to clot properly when we're bleeding, we see that the liver has to produce certain things that are part of those cascades. So again, let's talk about some common signs and symptoms. Now, this is going to depend on what the problem is. All right, so if we look here, we have erythrocytopenia. So erythro tells you red blood cells. Cytopenia means low count. All right, and so this is a decrease in red blood cells. This leads a lot of times to what we call anemia. Symptoms of erythrocytopenia include things like fatigue, headache. Of course, you're going to find normally a low red blood cell count. Paler, the patient will appear pale, and they may even have shortness of breath. Because they don't have as many red blood cells, they're going to have a harder time carrying the oxygen. Now, on the other hand, we can have erythrocytosis. Anytime we see cytosis on the end, this is an increased number. So erythrocytosis is an increased number of red blood cells. Symptoms here, of course, are going to be a high red blood cell count, reddening of the skin, so the skin will start to have more of a red tone, bloodshot eyes, increased blood volume, which also increases blood pressure, and increased blood volume in the heart itself, which could cause the heart to overwork. Okay, so this is erythrocytosis. We also have what we call leukocytopenia. So leukocytes are the white blood cells. These are going to be a decrease in the white blood cell number, and this is normally due to a weakened immune system. When we look at this, guys, remember this could be an immunodeficiency. It could be due to medications you're taking. Those anti-rejection things could cause a leukocytopenia. Leukocytosis, on the other hand, is an increased number of white blood cells. This is going to be where we have a normal response to a type of infection. Okay, we should see leukocytosis if your body is fighting an infection. Thrombocytopenia is low platelet count or thrombocyte count. This is decreased platelet count. This leads to coagulation problems. So we'll see symptoms like petechiae, which are small hemorrhages found in the skin. They almost look like a little pin rash. We also see that there could be echomycosis. This is large areas of bruising or hemorrhaging that could be taking place. Epistaxis, which is also nosebleeds, and then also bleeding in the mouth, gums, and mucous membranes may occur. Thrombocytosis is an increased number in platelets. This is actually pretty uncommon, and usually we see no serious side effects that occur from an increased number of platelets. There could potentially be an increase in clotting that could possibly take place, but then the number would then diminish and go down. So again, it's not very common, and we don't see any real serious issues. So guys, this is kind of putting everything into just a chart that we just talked about. So you have the erythrocytosis, you have the erythrocytopenia, leukocytosis, leukocytopenia, thrombocytosis, and thrombocytopenia. Okay, so this is just to give you an idea, putting it again more in a chart form. All right, so diagnostic tools. When we're looking at diagnostic tools, especially for the blood, we're going to do a complete blood count. This is with differentials and indices. And so differentials, guys, are going to be like where we would take it and break it down specifically into red blood cells, white blood cells, platelets. We would even go even further into the types of white blood cells that are present. This brings us to the index. Indices are index, kind of looking at what our normals should be and where the patient's at. We may also need to do biopsies of the blood forming organs, especially if we're starting to see an issue of the blood and it traces back to those blood forming organs. Hematocrit is another test we could do. This reflects the amount of red blood cell mass and seeing if it's proportional to the whole blood like it should be. Hemoglobin, also the levels of hemoglobin reflects the blood's ability to carry oxygen, and so this is important to test. Bleeding time, they can do a bleeding time test to look at platelet disorders, specifically things like hemophilia, thrombocytopenia, or what we call disseminated intravascular coagulation, or DIC for short. We could also do a prothrombin time. This is a PT test, a partial thromboplastin time, and an international normalized ratio. These types of things are to help with blood clotting. They're looking at the blood's ability to clot properly and in the proper sequence, because these different things we would be looking at, like prothrombin or these other markers, are going to be looking at the cascade of what's happening in the clotting time. We could also do a biopsy. Biopsies are going to be done in taking samples of the bone marrow or the lymph nodes. Now guys, because complete blood workups are a big part of this and looking at the indexes of like what we should see in blood, we do see we have some normal values. If you'll look when we're talking about red blood cells, specifically the erythrocyte number, hematocrit, and hemoglobin, there is going to be a difference between male and females, and again, this is totally due mostly to average body size. We do see that the index, though, for the red blood cells, we can look at a number of things. So like MCV is looking at the mean corpuscular volume, or the size of the red blood cells. And MHC is looking at the hemoglobin, kind of like the size and what the hemoglobin is doing. The MCHC is looking more at the concentration. Reticulocytes are the immature red blood cells, and we should still have some of those because they're the ones being trained. We just don't want as many of them as we have regular red blood cells, because then we would have too many trainees out there. All right, so this is what we're looking at. So erythrocytes, that's the number of red blood cells. Hematocrit is the percentage of the blood that the red blood cells take up. And hemoglobin is the protein that helps the red blood cells carry oxygen. On the other hand, we can see that leukocytes, remember, they have their range anywhere between 4,300 to 11,000. We can do differentials with this one as well, where they can look at the different types. We should see the band or neutrophils are the highest number percentage-wise. We then see that the basophils and the eosinophils should be the lowest value. If one of these is higher than normal, it could let us know that a certain infection is present or a certain disease is occurring. Platelets, again, should be anywhere between 150 to 350, even sometimes 450. Those are our kind of normal range for platelets. All right, so let's dive into disorders of the blood forming organs. And we're going to focus first here on the red blood cells. Now, the major disorder we see with red blood cells is anemia. Anemia is a decrease in the oxygen carrying ability of the red blood cells. So they're not able to carry oxygen like they're supposed to. Now, this could be to a number of things, and we're going to look at different types of anemia in a second. But no matter what type of anemia we have, symptoms are very similar. The patient will have a pale look. They'll be paler. The patient will feel fatigued. They may have shortness of breath due to the lack of the ability of these guys carrying oxygen. They'll have tachycardia, increased heart rate, headaches, irritability will be present, and they may even have syncope, which is fainting. All right, so let's look at the different types of anemia. So the first one that's the most common is iron deficiency anemia. This is a loss of iron or inadequate intake of iron. Now, what causes iron deficiency anemia? One is blood loss or low dietary intake. Now, when we look at this, guys, the big issue here is normally blood loss, and this happens mostly with women, especially during their menstrual cycle. They lose blood during that time, which means that those iron molecules cannot be recycled. And so anemia tends to be a bigger issue with women than it is men. But another thing is that we don't see as much of the dietary intake of iron as we saw before. One of the main reasons is how we cook our food. We used to cook our food in cast iron skillets or pots. Those actually added iron to the food, preventing this from occurring. We don't see that as often. We use a lot of non-stick type of things and stuff that don't have the iron present, and so we need to make sure that we're taking in enough iron through the foods we're eating. Now, treatment is increased dietary intake, or it may even include iron supplements. Now, if you'll notice, guys, here with iron deficiency anemia, the red blood cells are a lot smaller than they should be, and they've lost a lot of their color. Okay, they are what we would consider like hypochromatic, meaning they do not have that nice red color that we should see. Another type of anemia is folic acid deficiency anemia. This is where folic acid is needed for your red blood cells to mature. So causes of this are poor diet with not enough folic acid, overcooking the vegetables so the folic acid gets removed, or overconsumption of alcohol. Now, with this type of deficiency anemia, we do see that if we can increase the folic acid intake by eating more green and yellow vegetables and not overcooking them, it can be helpful, or also, again, increasing just with vitamins that folic acid. The next type of anemia is called pernicious anemia. Now, this one's a little different because if you'll notice here, the red blood cells are actually super large and they're not even really red in this case. These guys are where we have a lack of intrinsic factor. Intrinsic factor is normally a protein or an enzyme that helps you absorb B12. Okay, it helps you absorb B12 from your diet. And so when you have pernicious anemia, you do not have that intrinsic factor, which means you can consume B12 constantly, but you're not going to absorb it and it go into your blood. And this is why B12, it comes in injections, okay, because then it goes directly into the bloodstream. All right, and so this treatment is monthly injections of B12, and this will be something they'll have to do for life. The next one's hemolytic anemia. This is destruction of the red blood cells, and this is related a lot of times to antibody-antigen reactions. This is like if you were given the wrong blood type, you can see that it's destroying the red blood cells. This is a disorder of the immune system. Now, treatment of this is exchange transfusion, and or we may need to do a splenectomy, taking out the spleen. The spleen is a reservoir for blood, and if the spleen is being compromised due to this, we may need to remove the spleen to treat this quickly. Another type of anemia is sickle cell anemia. This one is hereditary, okay, and you have to get both recessive traits in order to get all sickle cell. It is found more often in African Americans, and the reason for this, guys, is if you were a carrier of sickle cell and you carried it back when we see with African descent in Africa, it actually gave you an advantage against malaria. The problem is if two people who carry sickle cell have a baby, there's a 20 or are just carriers of sickle cell, there's still a 25% chance they have a baby who has sickle cell. All right, now this is abnormally shaped red blood cells. They have a sickle shape to them. This does not allow them to travel smoothly through blood vessels, and they do not carry oxygen as well. Now, most of the treatment that we have to give here is symptomatic. There's no cure for sickle cell anemia, so we've got to give them medications that are going to help with their symptoms. Now, this can be done, and a lot of individuals with sickle cell here in the United States live a relatively healthy, normal life. They just have to take medications on the regular basis, and they have to watch for certain signs of issues. But if they're in a third world country, they are less likely to receive the treatment they need, and the life expectancy there for sickle cell is pretty low. Another type of anemia is hemorrhagic anemia. This is loss of whole blood. This means you're hemorrhaging, you're losing blood quickly. This is going to cause a complication to what we call hypovolemic shock. It can send your body into shock because you've lost so much blood so quickly. Symptoms include dizziness, fainting, and thirst here. And the thirst is the whole point of trying to get more volume in there. It doesn't actually fix the issue, but it is one of those symptoms. Treatment is we got to stop the bleeding. We want to make sure we're getting them enough oxygen and restore the blood volume. Now, guys, to restore blood takes a while because remember, we're going to be talking about going through the process of stem cells and the bone marrow and so on. It takes about 6 to 8 weeks to replace the blood that you give when you donate blood. So if you've had a severe loss of blood, we're going to have to do a transfusion. But again, we need to make sure that we give the proper transfusion so we do not cause another type of anemia, that hemolytic type of anemia. Another type of anemia is aplastic anemia. This is failure of the bone marrow to produce blood components altogether. Aplastic anemia, the cause a lot of times could be due to chemotherapy. It's damaged those stem cells, radiation, viruses, or toxins. Treatment is avoid a causative agent, like if we can avoid certain toxins or viral infections that potentially could cause this. A bone marrow transplant could also help, and then transfusions, okay, replacing the blood that is not being formed like it should. Okay, so transfusions. Now, this particular type of anemia also is going to be seen with what we would call pancytopenia, which is a decrease in all types of blood cells, not just red blood cells. We would also see a decrease in white blood cells and platelets with this. The next one we see is polycythemia. Now, polycythemia is different. All the other ones were an anemia where we didn't have enough red blood cells. Polycythemia is where you have too many red blood cells. There's two types. There's primary and there's secondary. Primary a lot of times is a hyperplasia, meaning a lot of the cells are being made by the bone marrow, whereas secondary is to meet a certain demand, that you're actually working out harder, low oxygen levels, things like that, and so you're making more red blood cells to meet that demand. Symptoms with polycythemia is an enlarged spleen, reddened mucous membranes, bloodshot eyes, and deep red coloration of the palms. The palms of the hands get very, very red. Now, treatment is to donate blood in regular intervals. Because you're making so much of these red blood cells, you are able to give them more freely. So every chance that you have that you get the okay, they would want you to donate blood. This would help with your symptoms, and it also would help others. All right, now we're going to switch gears and go to disorders of the white blood cells. So one that we want to look at is called mononucleosis. Mononucleosis is caused by a virus. Specifically, this is the Epstein-Barr virus that causes mono. So this is known as mono, or the kissing disease. Symptoms here are fatigue, sore throat, and swollen glands. Now, guys, when we talk about this being called the kissing disease, is yes, it can be spread because it is found in the throat and the lymph nodes in the throat through kissing, but it could also be spread by sharing utensils, drinking after one another, like sharing water bottles, that kind of thing. Again, with these symptoms, they'll feel very fatigued, they'll have a sore throat and swollen glands. However, this could progress and cause complications like a swollen liver or swollen spleen, and those could potentially be life-threatening complications. This particular disease, when we talk about mono, is very common in adolescents. And we are actually going to discuss this more in another video. The next type of white blood cell issue we see is leukemia. Leukemia is a malignant neoplasm of the blood-forming organs. It's an abnormal production of leukocytes, but these leukocytes are immature, which means they're not going to function properly in actually helping the immune system. Leukemia could be acute or chronic. When we talk about acute leukemia, it means it happens super fast. Chronic leukemia is going to be that increase in number is going to happen over a long period of time. Acute forms tend to affect children, progress rapidly, and a lot of times are fatal. Chronic forms normally affect older adults. They're more often asymptomatic, and they may not even be fatal. They may not even really know they have it. Now, when we look at leukemias, the cause is pretty much unknown. We're not exactly sure why it's triggered. But they can be classified in what we call myelogenous. This is where the bone marrow is being affected and causing the leukemia. Or they could be what we would consider a lymphocytic, which is going to be where the lymph nodes are the problem. So what are some of the symptoms with individuals who have leukemia? Well, we see fatigue, headaches, sore throat, dyspnea, which is going to be difficulty breathing, bleeding of the mucous membrane, specifically of the mouth and the GI tract, so the gastrointestinal tract, bone and joint pain, enlargement of their lymph nodes. So we'll see, like, if you palpate different areas where lymph nodes are present, they would be enlarged. The liver and spleen may also be enlarged. And infections. The fact that these particular white blood cells are very immature, it means they can't fight off infections. So you would see a lot of opportunistic infections come into play. Diagnosis. Well, guys, the main diagnosis for leukemia is to do a bone marrow biopsy. All right. And we'd also look at this to help with diagnosis using even just a blood smear. So if you look here under the scope, this is what in normal blood would look like with white blood cells. You'd see that there's not very many spread out through there. There's a lot more red blood cells. However, with somebody who has leukemia, they have a ton of white blood cells, and they're kind of mucking up the bloodstream. And remember, these are immature and they're not doing their job. Treatment for leukemia is normally aggressive chemotherapy. Once in remission, bone marrow transplant to replace the neoplastic tissue with normal tissue may need to be done. Okay, so not only would we use aggressive chemo, we may also have to have a bone marrow transplant here. The next group are the lymphomas. Now, guys, lymphomas are neoplasms that affect the lymph node tissue. These are the most common blood cancers here in the United States, are lymphomas. Some lymphomas are known as Hodgkin's lymphoma or Hodgkin's disease. This is going to be where the symptoms are mostly painless enlargement of the lymph nodes, like in the neck, like you see here in this picture. They're not painful, really. It's just that they're very large. They'll have weight loss and fever. We see that Hodgkin's is going to primarily affect young adults. The average age of people who deal with Hodgkin's lymphoma are around the age of 35. The cause is thought to be viral, where a viral infection actually triggers this to occur. How do we diagnose Hodgkin's lymphoma versus other lymphomas? Well, we actually look for the presence of a certain kind of cell called Reed-Sternberg cells. These are located here. You can see them in the picture. And when we take a biopsy of the lymphatic tissue, if these cells are present, then it is considered Hodgkin's lymphoma. Treatment for Hodgkin's lymphoma is radiation and chemotherapy. Now, if in remission for 5 or more years, they can actually say that you have been completely cured. There's still a slight chance it could come back, but if you can stay in remission for 5 years or more, then you have a very good prognosis. Now, non-Hodgkin's lymphoma, how do we know it's a non-Hodgkin's? Well, when we take the biopsy, there is no Reed-Sternberg cells. So no Reed-Sternberg cells are present. The symptoms are very similar. We see they still can have painless enlargement of their lymph nodes. These lymph nodes can be in the neck, the axilla, which is the armpit, or the inguinal or groin areas. They'll have fevers, night sweats, and even weight loss. Treatment is going to be a combo in this case of chemotherapy and radiation, but the prognosis is not as good most of the time when we talk about non-Hodgkin's lymphoma. Another issue we see with the white blood cells is called multiple myeloma. This is a malignant neoplasm of the plasma cells, or B lymphocytes. This is an occurrence that increases with age. We see that a lot of times individuals who have this we're going to see a peak of the disease around their 70s. These plasma cells will multiply in an abnormal way within the bone marrow. Diagnosis is that when we would take an x-ray, we would see honeycombed bone pattern in their bones. You can see that here in this x-ray. They will also have what we call hyperkalemia, which is an increased calcium in their bloodstream. We also will notice that they have these special proteins called Bence-Jones proteins, which would be found in their blood and their urine. And of course, we would need to do a bone marrow biopsy to determine for sure. Now, the problem is, guys, this is not normally detected early on. It's normally later when it's well advanced. And so treatments are normally chemotherapy and radiation, but they're not very effective. The prognosis is pretty bad once we diagnose a patient with this, because it is already normally widespread and very advanced before we find it. And one way we tend to find this is through fractures. Because the bone looks like honeycomb, it's very weak, and they have a fracture, that's what leads us to x-ray it, and that's how we find this. Or pathologic fractures are a common precursor of us diagnosing multiple myeloma. All right, so now let's talk about disorders of platelets. The first one we want to hit on here is hemophilia. Now, hemophilia is an X-linked hereditary bleeding disorder, meaning it is found on the X chromosome, which means it is sex-linked. This means that they have a hard time clotting. Their body is slow to clot, so a lot of times they're known as being free bleeders. There are several types, but type A is the most common. Okay, there's also a type B and type C. What we're seeing here is, depending on the type, they're missing a particular step in the sequence. Okay, so we see that there's a number of different chemicals and they almost line up like as dominoes. And with hemophilia, we just took one of the dominoes out. So when we knock the sequence down and it starts falling down, it stops at that point where the domino was removed. Male children will get this from their mothers, and their mothers are asymptomatic because their mothers are just carriers. Okay, so their mothers are just carriers of this gene. So it does affect male children more than female children, or males more than female, period. They are lacking a protein necessary for clotting. Symptoms in epistaxis, or the nosebleed that happens, we see that they will have lots of bruising and a prolonged bleeding time. They may even have what we call hemoarthritis, where they have bleeding into their joints. Diagnosis can be done by a blood test where we're looking for certain platelets, certain coagulation factors. Treatment, one of the main treatments is try to prevent injury from occurring. If injury does occur, treat the symptoms. Blood transfusions might need to be done, and concentrated form of clotting protein. So if they're missing a certain clotting protein, let's just say they were missing clotting protein 9, we would want to give them that number 9 protein. All right, now that we know the different types of hemophilia and what protein's missing, we can give more direct treatment. Again, though, there is no cure for this. We also see that there could be thrombocytopenia. Thrombocytopenia is also known as thrombocytopenia purpura. This is decrease in platelets leading to an inability to normally clot blood. It's not a necessarily genetic or hereditary issue like we see with hemophilia. We see that these symptoms include abnormal bleeding that happens in the skin, mucous membrane, and internal organs, as well as petechiae, which is that little rupture, the hemorrhaging of the small blood vessels that looks kind of like a pinpoint rash. Symptoms can also include things like ecchymosis, so bruising, GI hemorrhaging, so they have bleeds in their GI tract, again, nosebleeds, and hematuria, which is blood in the urine. Diagnosis could be due to platelet count, so we would take a blood and look at platelet count. We also see that they could do a bleeding time test. Treatment, avoid tissue trauma to reduce bleeding as much as possible. Vitamin K intake could help sometimes with clotting cascades, transfusions of platelets, and then we may also need to take out their spleen with a splenectomy. Guys, the spleen is a reservoir of blood, and so it's a heightened area that if injury does occur with somebody who has a bleeding disorder, they could bleed out very quickly at that area. So we may need to take out the spleen to help prevent that. So So guys, if you look here in this picture, this just shows you normal blood with the number of platelets versus somebody who has what we call thrombocytopenia, the low platelet count. A lot of times this is due to their platelets. They're formed, but they just don't live as long as they're supposed to. Okay, they're kind of weakened. They just don't live as long. The next thing we want to talk about here is what we call disseminated intravascular coagulation, or DIC. Now guys, this is a weird thing because it's abnormal clotting followed by abnormal bleeding. And you're like, wait a minute, isn't clotting supposed to stop bleeding? Yes, but platelets, guys, are a one-time use cell or factor. Once that platelet's used and released its chemicals, it's no longer functional. So we have to make more, which takes time when we're talking about going to your bone marrow and making more from stem cells. So if we had a severe injury, like a major trauma, and we have a lot of bleeding that's occurred, your clotting factors could all be used up. And once they're all used up, you're going to have abnormal bleeding in other areas. Okay, so you may have these little micro clots as well as these other areas where there's a lot of free bleeding that's taking place. DIC is a complication of certain types of childbirth where hemorrhaging happens, certain surgeries, tissue destruction, septicemia, snake bites, and even when a patient goes into shock. A lot of times a crushing injury or when there's multiple injuries can also lead to this. This causes multiple clots in the capillaries, and this is a life-threatening disorder. If you've ever seen like movies or different medical TV shows, they're not always accurate, but in some cases where the patient comes in and has tons of injuries and they start a surgery and then they realize that the patient just keeps bleeding, what they'll do is they'll pack the patient. They don't even like sew them up, and they put them in like the ICU for a few days for their body to kind of catch up and rest and slow down. This is normally because the patient was entering DIC. If we can let their body rest and create more platelets, and when we go back into the surgery, we're not going to cause them to continue that DIC, which is life-threatening. So let's look at some symptoms of DIC. We see petechiae, ecchymosis, so again, bunch of bruises, hematomas, which are going to be blood clots, okay, big blood clots, hematuria in the blood, blood in the urine, GI bleeding, hematemesis, which is vomiting of blood, and even blood in the stool. So you're noticing blood in multiple areas. Now treatment a lot of times is going to be where we want to give them heparin. Okay, heparin is going to help prevent certain blood clots from forming, but also we want to give infusions of platelets if they are not clotting enough. So it's a very big balancing act when we're talking about DIC. One of the biggest things is if we can just let the body rest and do its normal thing of creating platelets on its own, that's the best. But in some cases we may have to watch where heparin may need to be given to prevent clotting, and then other times where the platelets may need to be given. All right, so some rare diseases that are talked about here are thalassemia. Thalassemia primarily affects people of Mediterranean descent. This actually causes their red blood cells to be very fragile. They form normally like defective hemoglobin, and so because of this, they do have a type of anemia. It is genetic. We also see von Willebrand's disease. This is hereditary and also congenital. The patient's born with it. This is going to be where there's a deficiency in clotting factors and platelet function. Guys, the von Willebrand's proteins that are part of clotting, they actually help form the base of the clot. And if they aren't forming properly, then it makes it very weak. Kind of like if you build a tower with a good base, it can get pretty high. But if you build a tower with just a single base, it's very wobbly and falls over. The same thing can happen with these clots. If the von Willebrand proteins are not strong and not able to form a good base, the clot is very weak, and we could see a lot of bleeding issues. The other one is lymphosarcomas. This is a type of lymphoma, and this is going to be having symptoms similar to Hodgkin's disease, but it's very rare. This is a type of cancer that is even more rare than what we saw with Hodgkin's or non-Hodgkin's lymphoma. Now, effects of aging. What are some effects of aging on our blood and our blood forming organs? Well, age-related changes to our other systems like our immune system, digestive system, cardiovascular system leave older adults most susceptible to infections as well as nutritionally related blood disorders. Okay, so not getting enough nutrition like we should. Also, decreased iron in our diet could also affect our blood and cause anemia. Most common disorder in the elderly is them becoming anemic, and a lot of times this is due to poor nutrition. All right, because they are older, they can't necessarily take care of themselves as well, or they may refuse to eat certain things, stuff like that. We see anemia tends to be the biggest problem as we age. All right, so again, if you have any questions, please let me know.